Joining us now is Dr. Ezekiel Emanuel, the Vice Provost of Global Initiatives at the University of Pennsylvania. Dr. Emanuel, thank you very much for coming in to talk about this, because I think there's a lot of confusion. They're very, very expensive. They are often used more cosmetically than medically by, millions of people because they're so popular. But there are people, obese people, who really need them, and
Yes.
diabetics, and they become won't this make them harder to get if it's covered?
Right. First of all, these are amazing drugs.
Right.
They are the most effective weight loss drugs we've ever seen, losing about 20 to 25% of weight within a year. They are in shortage, and they are very expensive drugs as well. Hitherto, Medicare has been prohibited from covering weight loss drugs. I think that was passed a long time ago as a view that, high weight was a personal failing, less a condition or disease. But we know being obese leads to lots of other diseases. Diabetes is one of them, heart disease is another, stroke, arthritis, cancers. There are many, many diseases where we know if we treat patients and they get the weight off and they keep the weight off, health improves dramatically. So I think that's the pressure that the government is feeling. You're right, a lot of people use them cosmetically, which is totally wrong when people could benefit medically, in our opinion, and I've written that out there.
Now, just how this would work. Can President Biden do this before he leaves office by executive order or administratively? Or is this something that really will fall into Donald Trump's lap?
I'm a doctor. I'm not a lawyer, much less on administrative law governing Medicare, which is makes the tax code, rivals the tax code. The fact is, I think the idea is they're going to change or reclassify obesity as a disease, which I think effectively it is. There are obviously environmental and social components and individual willpower components to it. We do recognize that because the obesity rate has dramatically increased in the United States over the last 60 years, and that's not a change in genetics. It's really a change in the environment and the kinds of food people are eating and being advertised to. How that is going to work, an executive order that could be repealed, Medicare, CMS changing the classification of obesity, I'm not 100% sure, and I'm not sure about the legality. In the end, it does seem to me, even if they do something, Dr. Oz, who's going to be the head of, is nominated to be the head of the CMS, is ultimately going to decide. And he has a record of recognizing that these are very valuable drugs, and it's pretty undeniable that they're amazing drugs. That's not to say there aren't problems with it. There are problems, one of which is people often don't stay on them for the full duration and gain their weight back, which is not a good thing.
And so you mentioned Dr. Oz, and he is controversial. Let's talk about some of Donald Trump's other choices for top health officials. He announced last week Surgeon Marty Makary, who's made very controversial statements about the coronavirus pandemic, COVID-19 vaccine, and he would be the FDA commissioner. Former Florida Congressman Dr. Dave Weldon, who has promulgated false conspiracy theories linking vaccine components to autism, to lead the CDC, and Dr. Jeanette Neshawa, a Fox News contributor for Surgeon General. They're all going to work under RFK Jr., himself, of course, very controversial on vaccines and other issues. So when you look at this group of people, what are your concerns, if any? I am told that there are a lot of scientists in some of these agencies turning in resignations in anticipation.
Well, I think for some of them, they are probably very responsible. Dr. Makary is one. He has a disagreement. He's largely been data-driven. That's not to say everything he has argued has been right. He thought that natural immunity would attenuate COVID, and he said that said that thereafter we had the fourth major surge in COVID because of the Delta variant of COVID. But he did question some important recommendations, and I think he's mostly been a scrupulous, data-driven person, and I think that is got confidence. Dr. Weldon has advocated two issues which are concerning. One is he has propagated the idea that vaccines are linked to autism. The single article in The Lancet that was published in the late 1990s has been totally repudiated, withdrawn, and that idea has never been proven. And as a matter of fact, the opposite has been proven, that there does not seem to be any link. And then the mercury case, there used to be a preservative in some vaccines. It's no longer a preservative in the vaccines that are currently used and have been used for the last 15 years. So that's not an issue. And again, the research does not bear him out. It's a different kind. It's not free mercury that has been used as a preservative. And, you know, it's important to stay up with the literature and stay up with how these vaccines are manufactured and how they're preserved. And I hope that he does that. I would say that, you know, in general, these appointments have been a mixed bag. They have some good ideas. They have some ideas that are very problematic, like the ones around vaccines that I and others have written about.